The integumentary system. So this basically is the skin. And the word integument is derived from the Latin word for covering, so it's all of your body surface covers. So this includes your regular old skin, it includes your mucous membranes, we usually use this term to refer to the outermost layer of skin though, and it also includes accessory structures to the skin. So like hair and nails, for example. The integument is comprised of two layers. There's the outermost layer and the innermost layer. Oftentimes we think of it as being three layers, but really only the outermost two, the most superficial two layers, are part of the integument. The most superficial layer is the epidermis. This layer right here, it's one you're most familiar with, and there's hair follicle with its oil glands. This is made up of stratified, squamous, keratinized epithelium. Think for a moment about the implications of that. So it's stratified, so it has lots and lots and lots and lots and lots of layers. It's squamous, so it's got that flat sort of squiggly shape to it, pancake shape. And it's keratinized, which means the cells become tough and waterproofed. As with all epithelium, the epidermis is avascular. It has no blood vessels, but it is innervated. There are nerve endings embedded in the epidermis. The dermis, the layer just below it, all this pink thing with all the stuff in it, is mostly made up of connective tissue. You have a lot of other structures embedded inside of it. So strictly speaking, there's a ton of tissues here, but really the dermis itself is made up of dense irregular connective tissue and areolar. The most superficial part, closest to the epidermis, most superficially, is areolar connective tissue. Here you have nerve endings and capillary beds and things like that. And just deep to it, do you have the dense irregular connective tissue? That's effectively the same type of tissue as areolar connective tissue, but it's a lot more densely packed with those fibers, so you don't have as much room for cells. There's not quite as much ground substance here as with the areolar layer. Just deep to those two layers, you have the hypodermis, right here. This is essential to the health of the skin, but it is not technically part of the skin. So it is essential, but not part of the integument. In practical purposes, we treat all three as different layers of the skin, but in reality, in anatomical terms, it's not. This is overwhelmingly made up of fat. So is it going to be white adipose or brown adipose? Connective tissue. White adipose. White adipose. CT. So as you recall, with all connective tissue, there's lots of blood vessels, or there can be blood vessels, there can be nerves, and the hypodermis is abundant in both. This pads the skin for resiliency and helps aid in its stretchiness. Overall, your integumentary system weighs about 4.5 kilos. We're doing science, so we're going to really refer to everything in metric terms, but for your own purposes, that's roughly 10 pounds. So whenever you step on the scale, you can subtract 10 because that's just your skin and that doesn't count, right? Here's another diagram of the skin with all of its many layers. You'll notice that the epidermis here is actually divided into a bunch of different sublayers. We're going to talk about that later. The dermis itself is also divided into several layers. And then you have subcutaneous tissue. You have fat that is oftentimes pretty thick, right deep to it. There can be additional structures. For example, in your palmar skin, you have another layer of regular connective tissue that's just deep to the hypodermis that you might find. The dense regular connective tissue is part of your palmar fascia, but that would be, since all those layers are so closely associated, you might see that included. Strictly speaking, these are the three layers of the skin. or 2 layers. Sorry, the 3 layers that we commonly speak of as being part of the skin, but really only the top 2 are part. So major functions of the skin include thermoregulation. First of all, it is just an outside covering over our whole bodies that can protect us against the extremes of climate, the inside of our body from the extremes of climate. We have hair that can help keep us warm. We perspire on the surface of the skin. Think back to our negative feedback loops. How did that work? You have sweat glands that secrete sweat to the surface of the skin. Water carries, I'm going to use a different color here because there's so much there. I'll use that green to match the sweat glands. Right here. You secrete sweat onto the surface of the skin. At the same time, these capillaries are going to expand a little bit. So the heat from the capillaries can be absorbed by the sweat, and the sweat can evaporate into the environment. That sweat, the sweat made by your skin, can help whisk heat away in hot weather. The reason that humid temperatures feel so much more, or humid conditions feel so much more uncomfortable and oftentimes feel hotter, is because it impedes our ability to sweat. How well your sweat evaporates is dependent on how dry the air is. The more dry the air is, the easier your sweat has to evaporate. There's just not as much water in the air, so it can take on the water that you're secreting from your body. When it's very humid, on the other hand, your sweat has a harder time evaporating. The difference in humidity between the outside of your skin, where you're sweating, and the rest of the air isn't as steep, so you don't release your sweat quite as efficiently, and so you hang on to more heat and you get wetter and things like that. And the dermal blood vessels I mentioned, they swell closer to this, or they dilate closer to the surface of the skin, and that can help the heat be released as well. Those dermal blood vessels in cold conditions, conversely, can constrict, helping to shunt blood back towards your core, so that your outside of your skin might be a little bit cooler, but the inside of your body gets to stay nice and warm when it's cold out. We have externoreceptors embedded in our skin for sensation. That's not just mechanical sensation, okay? So that also includes, mechanical, like touch, pressure, but also pain, temperature, things like that. Anything where it's detecting what's going on in the outside of environment, you have sensory receptors for. Your skin serves as a blood reservoir. We don't often think of this, but your skin does hang, quite a bit of your blood at any given time does reside in your skin. And so losing a fair bit of your skin also results in a loss of that blood reservoir. About 5% of your blood is here at any time. You'll find when we go to talk about burns that missing even a relatively small portion of your skin can be extremely hard to manage and detrimental to your health. Finally, you can use your skin for excretion. Well, not finally, we have another slide of this, but you can, your skin excretes things. Mostly in sweat, you excrete things like nitrogenous salts, but you can also excrete certain types of aromatic compounds, certain types of like herbs and spices that you consume. Eat a lot of garlic, some of it'll come out in your sweat. Eat a lot of cumin, some of it'll come out in your sweat. Byproducts of prescription drugs can be secreted in your sweat. You can sweat alcohol a little bit. If you have a hangover, you might realize that when you smell yourself. And so you can excrete some things from your body by way of your skin. More functions of the skin include protection from physical assaults. We sort of touched on this previously because the skin is stratified. Right? You have tons and tons and tons of layers, so if you brush a couple of the superficial most layers off, it's not a big deal. The skin cells are layered very, very densely. They're packed in very tightly against one another. Remember, this is the only kind of stratified epithelium, well, aside from transitional, that has more than 2 layers. You can have like 50 layers of skin cells easily. In order to not take up any more space than they have to, they need to be layered together very densely, especially superficially. They have keratin, which is waterproofing and toughening, and there's also some glycolipids in there that can help with waterproofing as well. You have melanin produced in your skin, and this absorbs UV radiation from the sun. Remember, the sunlight is actually a form of a physical assault. When the melanin absorbs UV radiation, it can dissipate it fairly harmlessly so that you don't burn your skin. Those of us with less melanin are more prone to sunburns and more prone to the problems associated with sunburns, like increased risk of skin cancer, than people with more melanin in their skin. We'll talk a little bit later about the relationship of melanin and the creation of vitamin D in our skin too. Our skin helps protect us from biological assaults, aside from just making a barrier that microorganisms can't really easily traverse because of the layering and the keratinization and the glycolipids. It also secretes oils and sweat. These are acidic in nature, and you feature a couple of proteins, dermacidin and defensins, which impede microorganismal growth. So you also have a normal microbiome. That sort of makes it sound like this can't happen, but you do have these resident microorganisms. The normal microbiome of your skin is adapted to be cool with all of this. In fact, they thrive on this. So you have hundreds, if not thousands, of different species of microorganism, bacteria, fungus, etc., that lives on your skin full time and is quite happy consuming the dead skin cells that you shed and eating up stuff that you secrete in the oils of your skin and things like that. They crowd out, or they take up a lot of space so that your skin is really quite covered with this microbiome very densely. And in doing so, in consuming all those resources and taking up space, they can crowd out pathogens. There's no space, there's no food left over for pathogens to really take hold on the surface of your skin. Now, if you wipe out some of your microbiome, you can leave room for an infection to set in. And in fact, there are pathogenic cells all over your skin. They're just in little tiny spots. They don't get to really grow and take off. When you have a break in your skin, if there's bacteria adjacent to that wound, or frankly, there's going to be a bacteria applied into the wound in the course of your injury, but if there's pathogenic bacterial cells adjacent to the wound, or even normal microbiome type cells on the surface of your skin that are good on the surface of your skin but can become a disease on the inside of your skin. If it gets in, that can cause some problems. The more you've left your microbiome as a whole alone, though, the better off you'll probably be. We're familiar with this effect to an extent. We have a microbiome in our guts too, right? And if you take an antibiotic, especially a broad spectrum high dose antibiotic for a while, a lot of us end up with gut symptoms, right? You end up with some diarrhea or something. The reason for that is, at least in part, because that antibiotic is killing off some of the normal microbiome in your gut. When you do that, other bacteria have a chance to overgrow and take up that space. You now have this sort of a glut of food and space that other things can take over, and that can cause a disruption of normal bowel function. You also have resident immune cells, this over here, dendritic cells and macrophages, that should the skin actually be penetrated by a disease, that you can be defended before they get much deeper.